With this, we'll move on to the next pattern, that is granulomatous reaction pattern. Granulomatous reaction pattern, it's very easy and simple for most of us. It's basically granulomatous or chronic granulomatous reaction, and subtle variations are there in the granulomas itself, and few associated features which we would like to just highlight. So coming on to the first one, what is that is a BT Hansen's. What is characteristic in BT Hansen's here? Just change my pointer. There is an oblong granuloma here. You can see granulomas around the adnexal structures. Granulomas are oblong. If you want to see higher power, there is around the adnexal structures. There is a nerve bundle destroyed here, perineural granuloma. And here also you can see erectopyle being destroyed. It's an erectopyle muscle. It is getting destroyed by granulomatous reaction. So most commonly erectopyle involvement is borderline tuberculoid. These Hansen's disease will have granulomas. Since or tuberculoid, they'll have destruction electropylon muscle or nerve bundles, which is usually having a abnormally shaped, that is ovoid shaped or oblong shaped granulomas, unlike the rounded off ones in tuberculosis. Now, this is a case of tuberculosis or lupus vulgaris, what we call. So there is epidermal hyperplasia and there are granulomas throughout. Whereas in TBBC, what happens? There have to be neutrophils subepidermally. Subepidermally, there have to be neutrophils, unlike lupus vulgaris, which has diffuse granulomas and epidermal hyperplasia. There are neutrophils and deep-seated granulomas in tuberculous verrucomatous. So granulomatous, just to highlight the granulomatous reaction pattern. And what is this? What kind of granulomas you are seeing here? Here you are seeing granulomas which are confluent, which you are seeing confluent granulomas that are closely packed granulomas with very minimal lymphocytes. This is basically sarcoidosis. Superficial granulomas close to each other with minimal lymphocytes or complete absence of lymphocytes. It is sarcoidal granuloma. Of course, you're seeing an asteroid body here. It's in a sarcoid granuloma. So these are nothing but neutrophils rich granulomas, also called as suppurative granulomas. Suppurative granulomas are usually seen in the deep-seated fungal infections or deep dermatophytosis. Okay, most common, giant cell with neutrophilic infiltrate or granulomas or foamy histiocytes, most commonly seen in either foreign body or fungal infection. Now, these are important. These sort of granulomatous or histiocytes that are surrounding a large area of collagenous degenerated collagen, especially in the mid-dermis. Okay, this is a feature of necrobiosis lipoidica, where you're seeing necrobiosis in the mid-dermis with lymphocytes and histiocytes surrounding them. So, of course, clinical details become important here because you're seeing swollen collagen. I told you necrobiosis will use previously, it is nothing but swollen collagen or necrotic collagen that has been entrapped by these activated histiocytes that are surrounding them along with lymphocytes. Okay, so you can see. So, the lesions, if they're annular and present in the arms, chest wall, etc., with palisading histiocytes in the mid dermis, and the lesion is blue, then it is usually granulomanular. Unlike whenever on morphology, if you're seeing pink lesions like this, it is with palisaded histiocytes throughout, occupying the mid dermis and the deep subcutaneous, deeper areas. It is almost including that is involving the subcutaneous. It is most commonly the rheumatoid nodule. They're pink in appearance. Okay. So now coming on to the algorithms of granulomatous reaction pattern. This is fairly simple and most of you can easily remember this. One is naked granulomas, granuloma with a mantle meaning lymphocytes around that, interstitial with swollen collagen and with neutrophils or with refractile structures. You would have all deduced diagnosis by the time you see this division. Sarcoidosis, granuloma with the mantle is tuberculosis. TBBC, we have varieties in TBBC verrucomatous hyperplasia with dermal neutrophilic infiltrate and deep-seated granulomas. Lupus vulgaris, near normal epidermis or sometimes epidermal hyperplasia with granulomas sparing the nerve bundles. This is important here, sparing the nerve bundles. Granuloma with a mantle, BT Hansen's, atrophic epidermis with oblong granulomas. Remember, unlike tuberculosis, here in Hansen's, the granulomas are oblong or ovoid shaped around the erectopyle muscle, around the follicles, around the nerve bundles like this. Then LMDF, this is lupus miliaris disseminator faciae, where you see the facial lesions and Okay, granulomas with extensive caseous necrosis. Interstitially, with swollen collagen necrobiosis lipoidica, linear sandwich pattern, linear interstitial sandwich, and vessels are sandwiched in between this necrotic collagen, and granuloma annular. Granuloma annular, blue interstitial, I told you, because of degenerated mucin, blue interstitial granulomas, and rheumatoid nodule, that is red interstitial granulomas because of fibrinoid necrosis. Okay. With neutrophils, you have inflamed or ruptured epidermal inclusion cysts. That's also a very common thing that you can encounter. Granulomas with ruptured epidermal inclusions or inflamed epidermal inclusion cysts in the skin. You will also have histiocytes with neutrophil reaction. Refractile structure. Neutrophils can also be fungal infection or atypical mycobacterium. Okay, so with neutrophils, granulomatous reaction can be fungal infection or atypical mycobacterium. Refractile structures most commonly is foreign body reaction pattern. So again, to highlight, so sarcoidosis, TBVC you have here, TBVC, then lupus vulgaris. What is the difference between TBVC and lupus vulgaris? Here, neonormal epidermis or some epidermal hyperplasia, granulomas which spare the nerve can be anywhere. Here, usually deep-seated granulomas with neutrophils in the superficial dermis. Why? Because these are spread by contact. Lupus can spread hematogenously. TBVC is through contact. BT Hansen's atrophic epidermis with oblong granulomas, LMDF granulomas with extensive caseous necrosis, LMDF with caseous necrosis, necrobiosis lipoidica, linear sandwich pattern where the necrotic collagen is sandwiched in between inflammatory aggregates of histiocytes, granuloma annulaire, which are blue interstitial granuloma, mucin degeneration of the collagen. Alcyon blue stain is a must here. Rheumatoid nodule, red interstitial granuloma with fibrinoid necrosis. Okay. Then atypical mycobacteria, fungal infection, inflamed inclusion cyst, all can have neutrophils. Atypical mycobacteria, fungal infection, and inflamed cyst can all have neutrophilic infiltrate. Refractile cystis, your refractile structures, if you're seeing within a granulomatous reaction, it's most likely a foreign body reaction. Okay, any suture, any foreign particle, etc. So this is the simple algorithm for granulomatous reaction. So it is basically naked granulomas, granulomas with lymphocytic infiltrate, whether it's tuberculosis, leprosy, interstitial with swollen collagen, necrobiosis is there, and where there is fibrinoid necrosis, or it is mucin degeneration of collagen with neutrophils, can be atypical mycobacteria, fungal infection, or inflamed inclusion cysts. So this is the most common granulomatous lesions you can get in your practice, and there can be again overlaps. Say for example, you can see a granuloma in lichen as well. So there is lichenoid reaction, then there is a granuloma. Like that, you can have overlaps, but those are rare. So the common granulomatous reaction for you to diagnose an algorithm is here. Okay.